So Eileen, I just wanted to share with you that Katie will be a tad late. Mateo Pearson was having internet issues and may or may not be able to join. And then Matthew Clark, he had a conflict today and he sincerely apologizes. So those three we don't have to wait for. We can start as necessary.
Okay, thank you. And I think also that that Hallie had, I think you said Hallie also too was out of the country and thought that he wouldn't be able to. I think he was on your list.
Yes, yes. I'm not sure if it's he's traveling the world. Either it's Quebec today or somewhere else. It's been, I'm waiting for the next correspondence because it's always enlightening. So, but yeah.
Right. Yeah, and hopefully he didn't ask me to carry his bags, right? Like going to be traveling the world. Maybe someone could at least extend the offer like, hey, do you want to, I could be a porter.
Well, we'll see what he has to say about Canada and their cannabis industry because he will have spent some time up there. And so hopefully he'll have some intriguing insights.
Oh my goodness, you were going much more serious than me. I'm looking for a trip and you're looking for education. I like it. And thank you also for and hi everybody, and thank you also for sharing the agenda with me this morning. And I thought that maybe for everybody else, this conversation will be contextualized really shortly. But I had just emailed with the question about the yes and no campaign, and Gary had replied with a lot of really helpful information about that. That I think that probably. Actually, I think that probably because that has received so much media that even just your response and like how you had articulated, that's different. I think probably people will want to know. So here I am putting you on the spot, but I think it's something that maybe even briefly, if you could speak to, if that would work out, that would be great.
And actually, Gary, if you don't mind, I'll go ahead and address that a little bit, if that's okay.
Absolutely.
So what really has happened is that's a campaign that is being done completely by the Cannabis Control Division over at RLD. We had been asked to look at some of the materials at this point, I would say a year ago, but it was just about some of the content which mimics some of the content that we have in our own educational materials that basically was it basically was saying make sure to store your items, and as I think all of you have seen, our materials actually go into a lot more detail, but we never actually saw any of the graphics or anything else on it. So the campaign getting launched was news to us as well. I think the only thing that we heard was that they were going to launch it maybe a week or so earlier than it actually got out there. So we've been seeing those ads the same as everybody else. They are definitely interesting. There has been a fair amount of media about them. The Albuquerque Journal in specific actually wrote an op-ed, which was not a very favorable one, quite frankly. And it is one of those where we try to get our information out and the materials out through the website, but we quite frankly don't have a budget for a big media buy like this had. So we really can only do what we can do as best as we can. What I can say is that recently, the CCD, the RLD, the Cannabis Control Division, they actually did really like the educational materials that we have and have actually since then added their logo to their version. So they are also disseminating them with their logo as well as the DOH one. So we are making some inroads in ensuring that there's some better education out there. And really, at this point, I think that's really about all I can say on it.
Okay.
So does that help?
Yeah, very much. I was thinking I was going to ask maybe at the end of the meeting, but I think that fortunately I now realize my screen is only showing 4 attendees, but then when I look over in the participants, I don't know why it's not telling me all these other people who are here. So we may have actually covered it for everybody. So thank you. And thanks for contextualizing that. Yeah.
No, absolutely. And, and we keep putting more and more educational material out there. Our biggest roadblock right now is actually our graphic designer. And this is not on a bad thing. That individual just is so swamped and so busy. We are getting things to them like 2 months in advance, just so that it can come on up. But we've had pretty good luck where we've been rolling new materials out about every 4 to 6 weeks, give or take a little, since we started doing that. And so we'll continue doing that process.
Okay, wonderful. Well, with that, I think that we almost inadvertently then we covered a lot of business even before we started the meeting. With my apologies that that I asked the question before we had really formally started the meeting. So anyone who just hopped on might have been like, "Oh my gosh, we're already moving through things." So that was my shortcoming. And for those who are, so maybe we'll, of course, I know that people know that we're recording and that we will get started. And this is Eileen Barrett, in case you're on the phone and you're not sure who's speaking. And that maybe before we get to the agenda that is in the chat, which I'm going to ask for people. I know in Zoom, if you join after comments are entered, those are not available to you. In Teams, are they available? Do we know? Maybe just to be on the safe side, we can just.
Do you mean after the meeting is over, Eileen, or do you mean if someone joins late?
That's what I mean, the latter.
You know, I'm not actually sure of that, but to sort of help with that, Libby, could you maybe at about 20 minutes in and 25 minutes, if other individuals join in, go ahead and just repost the agenda?
Sure thing.
Thank you. Thanks. And so yeah, so thank you. And again, this is Eileen Barrett, and happy that we'll be here. And you can see that there is an agenda that is in the chat. And for those of you who joined when Dominic and Gary were providing information in response to a question that I had asked, I hadn't intended that to be so rich, the information that was shared before starting the meeting. And so thank you for your grace on that one. I'm glad that I know I learned a lot there, so thank you. And as we get started and going again, please, I know that some people are taking care of their kids, maybe a parent, maybe you're in the car, you are busy. So if you are unable to show your face, we still value that you're here and value all your participations, whether it is verbally or if you add it to the chat. With that, I'll ask everybody also that if we can refer to each other by our first names, because there are people who are MDs here, there are PhDs, and everybody here, we value everybody's contribution, no matter what is their degree and what is, yeah. So I'll start there. So maybe as we start to do introductions, because people know that I like to do this to sort of create a sense of community in this time that can be so, well, the Surgeon General just did this report about loneliness, and also there's all this information about just even having like small amounts of personal interaction, what that does for us. So I thought that I would ask that if we can introduce ourselves, and because there often is a question, related to that, I'm going to ask, and maybe we'll call on people. You can say where you're calling in from today, and then also if you are a cat or a dog person, and if you're neither, what kind of a person are you related to pets? Okay, so with that, because I happen to be able to see her laugh when I said that, Libby, you're up first.
I laugh because I'm kind of a freak about dogs. So, I am Libby, Elizabeth Bissio. You can call me Libby. My pronouns are she, her, and I am calling from Albuquerque. And I am a dog owner. I have 3 dogs, but I love all animals and especially love to give them hugs. So that's me. Let's go to Alan.
Good morning, Alan Plymouth from Deming. I am a dog lover, as you can see here. She's definitely a lap dog. She likes to be my secretary when I'm working on the computer. And we're just waiting for the summer solstice in the morning.
Love that. Thanks for sharing her.
Thank you. And maybe then we'll next go with actually with Dominic.
Good morning, everybody. Pronouns are he, him, his. And as far as for dogs and cats, actually, I love both. Unfortunately, I'm allergic to cats. So, but we have a yard kitty, well, two of them. And so we have those. They're very helpful and in keeping our garden free from rodents from the big giant field that's behind us. But I will say most recently, as of 2 weeks ago, my favorite is we just got bees for a beehive. And so I have to say at the moment, I'm really a bee person. So sorry to go outside the box there a little, Eileen, but I have to go with the bees.
As I recall, you often go out of the box because when I asked dark chocolate or sociopath and then said, okay, dark or milk, you said pasta. So we love creativity. So thanks.
It is true.
Yeah, thanks. And Haley.
Hi everyone, I'm Haley Peterson. I'm with New Mexico Department of Health, calling in from Albuquerque today. And my pronouns are she, her. And I'm a dog person. I like cats, but I'm definitely a dog person. Have had dogs all my life, have 2 dogs now. So definitely a dog lover.
Thanks. Eleni.
Hey, good morning, everyone. I'm Eleni Bukovalis. I'm calling in from Placitas. She, her pronouns, dog person, but we do have a cat who is wonderful. There's some cats that are maybe not, but our cat is amazing. So I guess both.
Nice. And I don't know if she's able to unmute herself, but hopefully Crystal.
Good morning, Crystal Apodaca calling in from Albuquerque. I am definitely a dog person, and I used to say I didn't like cats, but as I get older, there are some cats that are okay.
I feel the same way.
Yeah.
Brenda.
Good morning, everyone. Brenda Martinez calling in from Santa Fe, and I would say probably a dog person. In fact, we were just talking about cats, but they do have a purpose outside if they are doing their job. So we don't want any critters.
We don't want any unwanted critters. Thanks. And Gary.
Gary French calling in from the medical cannabis program, he, him pronouns. I'm a dog person as well, and I can really attest to how Libby does love animals. We have a cannabis and pets handout, and you know who was the inspiration and force behind that. That was Libby. So when you see that and look at it, yeah, that is an attestation to how much she loves those animals. It's always great.
Oh, nice. Thank you for doing that. And we'll see if we're able to add that to the chat. I think that would be helpful, the link, because I bet everybody wants to see it as much as I do. Thanks. And Rosanna.
Good morning, Rosanna Chuleta calling from the medical cannabis program here in Santa Fe. I am a cat person, but I'm recently a dog person now. So a little bit of both.
Nice. And there also, I see meeting guest, and I don't know if that is someone who is joining. I don't know who that is. So maybe if you could let us know who you are. Who may not know that you are listed as meeting guest, but you are still muted and you haven't yet told us about dog or cat. And I'll give you about 7 seconds in case it's someone who can't unmute themselves. Okay, maybe somebody who can't unmute themselves, which is okay. I think, is there anybody who I missed? No, okay, all right. Well, thank you everybody for going with it. And I should have said that Eileen in Albuquerque, she, her, hers, and that like Crystal, although I am a hardcore dog person, that over time I'm like, cats can give snuggles too. That's pretty good. And if you have a mouse in your house, you're like, wow, do I wish I had a cat. Anyway, so thank you. So with that then, I think that although she was with us last time, that extra grateful that she's last time as a guest, but this time as a new committee member, and I'm delighted that Crystal Apodaca has joined the committee, and we are thrilled to have you, and heard a little bit last time, but in case everybody doesn't know you, I wonder if Crystal, if you could tell us just a wee bit about yourself.
You bet. Thank you. I'm so excited to be part of this. And thank you. Everyone's been so welcoming. let's see, I am a nurse practitioner hospitalist. I practice primarily at UNM here in Albuquerque, adult hospital medicine. I have certified patients for medical cannabis for 6 years. I haven't recently, it's been a couple of years since I have. So got to meet Gary through that. Very fun. Let's see, I am very passionate about harm reduction and have done some talks and some papers and such on it. And I'm incredibly passionate about New Mexico. And so this is a perfect opportunity for me. And I'm excited to contribute and learn. And yeah, I'm just excited. Thank you.
Well, we're excited to have you with us, and thank you. And yay. Let's see. And so the next, would love to hear the on our agenda the update from the medical cannabis program, and I will mute myself.
This is Dominic. I'll go ahead and start, and then I'll turn it on over to Gary. We don't really have a whole lot as far as new information, other than the new statute, which it was Senate Bill 242, did go into effect this past Friday. We did anticipate getting a higher volume of calls and inquiries regarding it, but at least so far, we actually haven't gotten very many inquiries regarding it. What 242 really did is it changed the enrollment for the patients in the program rather than patients, and this was very confusing the way the previous statute was set up, is patients would enroll, they would get a 3-year card, but still had to get all of the same paperwork from their medical provider every year to maintain that 3-year card. So in essence, they got a 3-year plastic card, but they still actually had to re-enroll every year. So that didn't really make any sense, and it really was confusing for patients, providers, and many other well, basically anybody who was reading the statute. It did also get confused a little bit more because the first time that this really kind of went into effect, when it really started to happen, we also had COVID hit. And so in order to be able to help patients, we had done some extensions for patients on COVID or with regard to COVID, especially during those first 6 months of the COVID pandemic. And so that created some additional confusion for people because they would say, well, my card's expiring, but in our system, their card didn't really expire for another couple of months. So what Senate Bill 242 has done is it has actually streamlined everything so that patients no longer have to do that annual submission of paperwork. We do recommend they still continue to see their provider. In fact, quite frankly, they should see their provider more than once a year. And we include that in some of the materials and the information that we're putting out there. But the provider and the patient only have to submit their paperwork every 2 years. So that actually halves the amount of paperwork that needs to be done for everybody involved. It reduces a lot of the barriers that patients were experiencing with being able to maintain their status within the program and reduces that confusion. So rather than you have a 3-year card, and what would happen is people who had the card, they would be calling us all the time saying, do I need to do this annual certification? And it's like, well, yes, you really do. But that has now officially gone into effect as of Friday. So anybody who is getting enrolled into the program as of starting on Friday receives that 2-year card. Now, if somebody had gotten their 3-year card, say a couple of months ago, their expiration date doesn't change. So they still have that 3-year, they just are not needing to do the annual verifications each year. So we didn't take any time away from anyone. And then of course, as time goes by, they will, of course, all be into that 2-year cycle. Now, the other great part is that our online program for enrollment has been moving forward very well. While we have had a little bit of pushback in a few areas, what we've actually found is that the barriers that so many patients were experiencing are evaporating away. And some of this is that as we continue moving forward with the online, for example, I will give one example of where we had a patient who was experiencing homelessness. And one of the things that they explained to us was when they had to do the paper application, and I'm going to walk through the steps of what would happen. They had with their provider to go find the paper application. So, and they did not live in Santa Fe, so they had to contact us to be able to get us to mail the paper application to an address that they were going to have access to. And that's really important because so many people experiencing homelessness don't have access to a mailing address, or at least on a regular basis. Or, for example, say it's at a relative's, but their relative gets pissed off at them for some reason. They no longer get their mail or not in a timely fashion, all those things. Or they had to go to a library, print it on out, or go somewhere else where they would have access to a printer. And that's if the provider didn't have it as well, which often had been the case. We did, of course, have it online available for people, but most often they would go that paper route, partly because they didn't understand that the other options were available. So that also added time, because to get the paper application, even if they called us, we mailed them the paper application, they were able to get that application right away, that still would be several business days with regard to mailing. Then they would go in and see their provider. The provider would sign off, do their portion, provide the clinical notes. Now this person experiencing homelessness has that paper with them, has their clinical notes with all their personal health information, and let's hope their backpack or whatever doesn't get stolen while they're out and about before they can mail it back to the program. So if that doesn't happen, they get it in the mail, still takes a few days to get to us. At the program, we were reviewing applications. It was between every 2 to 3 weeks to review paper applications from the moment we received them. Then we would print the card, which would take several other days, and then that would go back to the patient again through the mail. So now we're already talking a minimum, really, for someone who's experiencing homelessness, 5 weeks or more to just go through this process. And that's if everything went well. So they didn't lose the application in some way or another. They didn't run into any other issues. They were able to get in and see their provider right away, all of those sort of things. Any stop or anything that could happen anywhere in that process could actually then create additional barriers that would extend this out for months. So now what's ended up happening is the patients go through and they go see their medical provider. They don't need to obtain an application in advance. They go see their medical provider. Their medical provider does their part online. The patient receives an email, and even if they don't get an email, they can check through their account once they've registered. And then they just approve their portion, do their signature. And then what we have found is, and I can tell you this, on Friday, all applications that had been received by the end of the day on Friday, and I'm saying about 4:30 p.m., had been reviewed, and all of them that were complete had been approved. That means that that individual who before would have been waiting 5 or 6 weeks could have theoretically received their application and had their card available electronically within a day. Now, does that mean that there aren't some other potential barriers? Of course there are. No matter what process or situation we use, there are going to be some barriers. And what we keep doing is we keep talking with providers to ask what experiences, what problems are individuals having so that we can actually address them and help reduce them. By the way, I'm just providing this one scenario, but there have been many scenarios and many situations where this has actually reduced down barriers, made it so much easier and faster for individuals. And by the way, this doesn't even account for, let's say that individual experiencing homelessness, 6 months after they've had their card, they lose their backpack at that point with their card in it. Now they don't have access to their medication. They can't purchase it. They have to then, would in the past, submit a form to get a new one. Now all they do is they go on electronically. And if someone doesn't have a smartphone or any of that, they can go anywhere where there's computer access to be able to go in to actually retrieve that. And they can also print it if they need to. So they can print it themselves. Again, this reduces down all of those barriers and all of those times. Now, we do also have a few situations that we've run into, for example, where individuals can't sign their application due to medical conditions such as rheumatoid arthritis or other types of, we've had several individuals who had extreme visual impairment. And so we are able to accept letters of accommodation from the medical provider for a letter of medical necessity for that accommodation, and actually then assist those individuals. And but one of the biggest issues, of course, is people sometimes then go, what is a letter of medical necessity? And so we've been doing a lot of education in those areas. And so far, and what it comes down to is if a patient is running into an issue, if they call us, we're able to walk them through or determine or figure out ways that they can actually obtain their card through electronic means. And that includes, we've walked people through creating an email. They may not use the email for anything else, but it is amazing how many people say, oh, I don't have an email. And we ask, do you have Facebook or any of the other social medias? And they go, oh, yeah. Well, then they actually have to have an email to be able to do that. So, or we've had people come in and say, well, I don't have a smartphone. And we ask, well, may we ask what kind of phone? And they'll say, I have an iPhone. So sometimes it's even about language or things like that. And so we're actually going through and helping to educate not only providers, but also patients and helping them to do this. And part of what we also see is the world is moving more and more towards this with electronic medical records, accessing your test results online, doing all those sort of things. And so we're actually helping people to learn how to do some of those. We've had several positive responses from patients who said, oh, I didn't even realize this. And now I've been able to go in and access this, this, and this through their online systems and portals at different, medical and or even other things. One patient actually shared with me that, wow, this was easier than getting my Kroger card, my Smith's card. So just to give an idea, we keep moving forward, we keep working on it, and we have at this point just under 40,000 of our 100,000 patients have actually successfully registered online. So, and that will continue. So we're actually exceeding the number of patients that we had anticipated at this point. We had thought it would be somewhere around 30,000. So this has been a really great move forward. Oh, the other thing this allows, by the way, which is really important for this committee, is it allows us to collect better demographics through the online system. So we'll have some better ways to be able to show that here in the future. Okay, Gary, did I miss anything?
Well, I was just going to say, just, as patients utilize the portal and enjoy it and are signing up by large numbers, so are the medical providers. The number of medical providers has not trailed off. We continue to get medical providers submitting applications to be an online portal provider daily. And I thought we would be saturated at this point, but we continue to have medical providers. Now, some medical providers may show a little reticence at the get-go, but once the staff and the providers seem to use the portal, then all that evaporates away. It's a matter of using it and putting it into practice. And upon doing that, the providers do seem to be responding to it. They can see the benefits there. So again, just like the patients, the providers definitely are continuing to migrate to the portal as well. One thing I saw that Katie had joined us here, but hi Katie, we have a new member, and Crystal, you're there, but we do have a new roster up as well. So if you do want to review any more of Crystal's experience, what you shared earlier, it will be available. You can read it on the roster that is posted on the webpage with wonderful pictures that y'all have submitted. So I do share that reference with you in case you did want to read more. I was going to talk a little bit more later on, but I'll just go ahead and sort of get to that point right now so that we can get on to the other presentations. But I was going to talk a little bit about, the current labeling regulations. I know that we had the journal articles and we talked about this. And again, I think it was more in reference to Colorado, but we talked about, the issue of labeling. And of course, this always comes up with the youngsters. And interestingly, during our legislative session, there were a lot of bills that were also introduced talking a lot about, the regulations around the labeling. And again, this isn't something that the medical cannabis program necessarily gets to do or help with. This was all done over an RLD under the Cannabis Control Division. But I do think that there, might be a little bit of an ignorance with regards to how thorough a lot of these regulations are. We see this convergence of media attention and cannabis, and with these bills, what I found is that a lot of what they were trying to address was already in regulation. So I'm going to share my screen and just sort of show you where these regulations are so that we, can become familiar with them in a little more detail in case there's a topic there that we think is being missed. We might want to see if there's actually the regulation there that addresses it. Now, if the regulation's there and addressing it, but something's still not gaining traction, then, what would be the issue with that? So those are things I think the committee can discuss. So I will share my screen real fast. So if you go to the RLD website, you just go down to Cannabis Control Division, view applicable rules, and you will see the sheer volume here. You have New Mexico Administrative Code, you have all of, here's the packaging, labeling and advertising, health and safety, food protective, product safety, quality control. So again, there is a lot of information here, and here you can read in detail the specifics of a lot of these regulations. And, upon reviewing them, I do find that they're quite complete. And so, if we're in a setting and someone's like, oh yeah, they're not addressing, cartoon characters, I actually do believe there's one in here that talks about that or talks about mimicking packaging. So I invite you, because of the topic from our last meeting, to look through these, and I think you'll be surprised again. And maybe there's themes here that need to be further fleshed out or disseminated to the public so they're more aware of it. But this is where you'll find those. And not just that, like I said, there's, here's cannabis servers and licensing. Interesting. And so quite a bit of information here under RLD's website. So I will stop sharing. But I wanted you to be aware of those. And again, talking about journal articles, I invite and implore anybody that would like to share next time, please just let me know if that's something you would like to do. I think that in keeping with that tradition, that we can always have a nice topic to talk about during this meeting. And so today I do want to pass it off to Elizabeth and Haley, because they were able to attend a New Mexico Department of Transportation Cannabis Summit, which took the whole day, and again, there were some rather interesting things that came out of that, I'm going to let them share, but yeah, good stuff. Libby.
Cool,
Haley.
thanks, Gary. I'm going to share my screen. So as Dr. French mentioned, we attended the Department of Transportation Cannabis Summit. And so one that really stood out to us and that we're going to share today, kind of try to recount what Jessica Bloom shared with us. She is a researcher over at UNM, and I'm going to pull up her slides. So this is her presentation entirely. We wanted to get her to come and share it with all of you, but she wasn't able to make it. So I asked Haley to work with me on just trying to remember some of the important facts that she shared with us. And I will put the link to the slides. They're available on the website, or her website, for you to all review, but just a few good tidbits of information. Sorry, I'm trying to do like too many things at once. Let me get this up. Okay, can you all see that? Gary, I can just see you. Can you see it, Gary? Okay, cool. So as I mentioned, we went to the Cannabis Traffic Safety Summit, and these are Jessica Bloom's slides. She's a research scientist in geospatial and population studies. And so one of the things that she did note was, when looking at this data, the data is not complete. It takes her and her team a while to kind of comb through the data and make it available and presentable for everyone. However, some of the findings that she has is really great. And I will say there were a lot of limitations to any data involving crashes in cannabis and other drugs as well. So that's something I do want to point out. So Haley, just jump in whenever you'd like. I can't really see anything but my screen. So if there's anything you'd like to share, please go ahead. So this first one is probably the most important thing to remember. A few tidbits that I specifically remember. Drug involvement is likely underreported by officers. And so a DUI can be for alcohol or drugs. And so one thing to keep in mind here is that if alcohol is present for driving under the influence, and this person is going to be ticketed or get an arrest, they do not test for anything else. So if alcohol is present in the blood, and that person may have other drugs or cannabis or any substance in the blood, they aren't going to do any further testing on that individual, which really is limiting to the data and just understanding the impact on cannabis and other substances in the state. And part of that is because it's easier for officers to prove impairment by alcohol. It's easier to test and it's less expensive. So they are not having to send any blood or anything like that. Any points you wanted to make on that one, Haley?
Yeah, no, I think that covers it really well. I think one of the other things they mentioned is that they can't draw someone's blood without a warrant, I believe was part of it too. And so, there's no breathalyzer or oral fluid test at this point for cannabis that's reliable. And so they would need blood pretty much to prove that someone was using cannabis, but they need a warrant for that. So yeah, so it definitely seems like they're way more likely to just stop after if they've proven alcohol involvement at that point, they're likely to stop at that point. So, yeah.
Yeah, definitely. Thank you. And so another sort of limitation within any of the data that was collected here too, it's data that was reported by law enforcement. So Jessica did mention that the whole process for documenting any sort of impairment is lengthy. And so that can be a barrier to getting good data. And so that is something that she mentioned. All the data collected is from law enforcement. And yeah, I think that's kind of what I've got here. What else? And she mentioned, here you can read cannabis specific data is only collected for crash related fatalities. So they do run more extensive testing after a person has unfortunately passed. So they're able to, of course, not have to have that warrant, as Haley mentioned, and they do a little bit more extensive drug testing. But as far as DUIs and people who are living and experience a crash, we have limited data there. So she does have a few charts that we can kind of go over. You can take a look at it. But again, the data for 2022 is incomplete, or it was incomplete at the time of this presentation, and that was back in April. So you can kind of see here that, of course, the drug-involved crashes has increased over the years, as well as percent of total crashes. It's kind of relative as the increase goes. Anything to say about this one, Haley?
No, I imagine it'd be great if we could have her come and talk maybe once the 2022 data is finalized. Yeah. But yeah, I imagine that it might even be a couple more months if I had to guess, just with how mortality data goes, at least from our end. So
yeah.
Now, when they say drug involved, is that both alcohol and other illicit substances, or is this substances other than alcohol? when she uses the word drug involved?
So it says here at the very bottom, sorry,
Oh,
I
there we go.
didn't scroll up enough to see that. But that's they define it as a crash where the officer selected under the influence of drugs or medication. So,
Okay.
and again, that is very reliant on the officer's judgment.
So it looks like her
s-
perception was it was going to be larger in 2022 than 2021.
Yes. Yes, they were still, yeah, again, working on that. So it was a great presentation, but again, it was kind of almost like, like I wish we could see a little bit more, and that the whole process for New Mexico was a little bit different so that we were able to get better data, but they're not really doing it for us. So this one is with the fatalities. A fatality who trusted drug positive, not a measure of impairment. So that's something to keep in mind. So they could have a little bit or a lot. And it also gives definitions of the stimulants and narcotics here. So this is comparing drug-involved fatalities over the years with different substances. Dominic?
Is this, for example, if someone has polysubstance in their system, would this double count them? Or is it just counting the main? I mean, I guess if it's not a measure of impairment, it's not counting the main one, just what's been tested. So like, for example, would it be in 2021, 71 had cannabinoids? Was that, out of that 71, there were also 30 who had stimulants or narcotics, depressants, any
I
of
don't
that.
remember. Do you remember that one, Haley?
Yeah, I don't recall if she said they were mutually exclusive counts. We'd have to clarify that with her. But another big thing to point out on this is that for the fatalities, and it notes it on that vertical axis there, is that this is drivers and passengers. So it's not like it's just noting here's what the driver had in their system. It's noting both too,
Yeah,
which I
that's a
think
good
is
point.
an important note.
For sure. So we can move up. And this one is
think
just
Eileen had
drivers.
her hand raised too.
Oh, sorry, Eileen. It's hard for me to see anything aside from my screen.
You're muted, Eileen.
Oh yeah, thanks. Thank you. I wonder if we could go back to the last screen because I want to make sure I understand that data. Because so this is the drivers and passengers having this in their system, or is it the drivers, what was in the driver system? Wait, no, never mind. That's really tough to have that data aggregated, I think, to combine drivers and passengers. Anyway, maybe it's less a question now, turned into a statement as I recognize as I was speaking. So never mind. That's a little bit tough. I think it's also a little bit tough to, I think it would be helpful to me did they clarify in person about inhalants and depressants also too? Because of course, people inhale fentanyl and heroin, but also meth.
I don't, and this is why it was kind of tough to want to do this, because this isn't our data, and so we're just kind of recounting anything that we remember. But we will try really hard to get Jessica to come here maybe this fall to try to clarify some of this, and hopefully, as Haley mentioned, have a little bit more data available for us.
Yeah. And I'll say, if I had to guess, inhalants is probably a category on its own. Like inhalants, when we report drug overdose death, would be its own category. And I can't recall the specific substances, but we wouldn't, like if we have a narcotic involved death, like opioids and stuff, we wouldn't call that an inhalant death, even if we think they might have been inhaling like a fentanyl pill or something like that. That it's a different category. So if I had to guess, those are probably different categories there, and not necessarily like method of use, more like the type of substance.
Sure, thank you. And I think also I think everybody here knows this, but that this statute that brought this committee together, that road safety and driving while impaired is one of the 8 dimensions that we create a report on. So just so everybody knows that this is nice to know about, it's also something we need to know about.
Yes, and that's also, thank you, Eileen. Why we wanted to share this with you, just to get started on some of the things that are relevant. And Haley has a great presentation after this too about it. So just kind of get you primed for some of the data that yes is important for the write-up that we're going to be working on. So this one is just vehicle driver fatalities, and the blue is where there was cannabis involved in that crash, and then it gives you the percentage of all driver fatalities. We've got that one, and this one is involved with pedestrians, and they call it pedal cycles. So whether it's a bike where you pedal, I guess, instead of a motorized bike. I guess I don't have too much else to say. I will put this data in the chat, these slides in the chat, so you can take a look. Anything else you'd want to add on any of this data, Haley?
No, I think it's been a challenge in other states too. Like, I don't think this is just a New Mexico issue, which I'll go over a little bit, but yeah, it's definitely something where I do wonder, because I think one of the things she mentioned is that on some sort of crash report form that they get for their data collection, because she's part of the traffic research unit at UNM, that they don't seem to separate out the drug type that the people on scene think were involved. I don't know. There was something there where if maybe we could improve how that system works. I wonder if we could get some better data, because then they have the toxicology for the fatalities, but for like just a general crash report, it sounded like I don't know. I wonder if we could try to make updates to whatever that system is they use to get more specifics there. But it's hard to know. I certainly don't work with this data, but I think we'll definitely be working with the UNM group closely if we're going to be including it in any reporting to the legislature, because they're the ones that work on the traffic data. So
absolutely. Yeah. Great, thank you. Okay, I think let's move on to Haley's presentation, and we can get a little bit more information.
Well, and maybe Dominic, I was just, can the Public Health and Safety Advisory Committee in the report make suggestions with regards to data collection on how to perhaps improve it? Or is that a little outside the wheelhouse?
No, that is absolutely, because part of it is going to be, the report is not only about what data is available, but also potentially limitations. So that can absolutely be a part of the report and should be like its own section of the report, quite frankly. Or again, as we start looking at how the report is set up, it could be in each section. There could be at the end of that a little limitations, paragraph or two that says this report or this data is not available, and it would be helpful if it was, going through that sort of information, and then a summary at the end. But again, that's more about format, but content wise definitely can be included.
And I was curious, did the presenter was there information that she wished had been presented? Like, I'm just wondering what were some of the items that she felt should be added, and how maybe she was going to go about doing that, or did that come out of the presentation at all?
Yeah, I think she talked a lot about the limitations of the current reporting. And so, I think she had the same sort of thoughts that we all have of like, I wish we had more. But, it's just there's limitations on the system as a whole at this point, especially since we don't have any reliable way to say for sure they were impaired. Cannabis can be in the body for so long that for all we know, even if we see an increase at this point, my understanding in our current data, even if we see an increase, we can't necessarily say those people were impaired. It just might be that they've used recently, and maybe not right before they drove, but maybe a week before that, so it's really a challenge, I think.
I feel like so that was incredibly helpful, of course, and I wonder if when we think about what are some data improvement suggestions, I think it will be interesting to also consider to work through, not necessarily to consider whether impairment was present, right? Because we don't know what was the impairing substance. We just know if impairment was present, but it's also helpful to know if there was no impairment, right? Because that would be a completely different data point there, of course, because I think everybody knows that one's drug test could be a month, that they could be positive. Yeah.
And this was all motor vehicle. Was there any talk about bicycles?
I believe there was one slide that was about pedestrians and pedal cycles.
Okay.
Yep, the last one I shared was that
Okay.
there is one on pedestrians and yeah, pedal cycles specifically.
Bring up a really great point about the fact that, you know, especially with regard to cannabis, if this data doesn't show the levels or quantity of a particular substance, that's really, I mean, someone could have been smoking or eating an edible a week before and then be in an accident and it'll still show up, but they not really have anything to do with the accident. So I would anticipate we would see those numbers increase anyway, regardless, I mean, if we were looking at it from this standpoint, because you're going to have more individuals who are utilizing cannabis potentially, but not necessarily to a degree of impairment. So I think that's going to be, as Eileen said, that's going to be a really difficult thing to sort of suss out and separate. It's almost going to need multiple factors, including level of substance, as well as, you know, officers on scene and their observations about impairment, for example.
Yeah, and another thing that you're reminding me of with that point too is there was some discussion, and it might have been with the person that was from Washington Department of Transportation. I can't recall exactly because it's been a couple months now, but essentially they were talking about the difference between someone having like Delta 9 THC, like the active compound, versus like the metabolites in their system at the time of testing. And so it sounded like in Washington, they look more for like the active compound. And I'm not exactly sure how it worked in the traffic data that we had, if they were looking at, you know, any indication of cannabis use, or if they were looking just at sort of like those active components. And I think Washington had they were talking about like the active, like actual Delta 9 THC, but then also one other metabolite they would consider because it's like one of the early ones or something after use. But then there's another component that is often shown on tests that would indicate more like, oh, you used, you know, like a week ago or a few days ago or something like that. But I'm not a chemist, and so I don't want to speak too much on that. But that was sort of an interesting point that they made as well, is that might be something if they have those specifics to consider.
Yeah.
Did the active metabolite correlate more with impairment?
Yeah, I believe the point was that like the active metabolite would be more indicative of like recent use, so that you'd maybe, even though you still maybe couldn't say for sure they were impaired, you might at least more reliably be able to say that they used recently to when the crash happened. I don't know. Still a challenge, it sounds like.
If I may, I would ask us to exercise caution on the issue with the metabolite, because you said it so well, Haley, that it might give you a sense, but it doesn't necessarily correlate to impairment. And I think also another thing that, or I'm wondering if they talked about there, was that the difficulty that officers have in all of their training is generally in recognizing impairment due to alcohol, because it is different than impairment due to other substances. And I only know this because a friend of mine who's now at the Department of Justice, but that when he was, he used to help lead trainings on this in the Farmington area. And that was, I guess, a real issue in Washington state that they had was that officers just understanding how to recognize impairment from different. I don't know. Did that come up?
That was another thing that came up, and I do remember now that there were a few, I forget what they called them, but they're specific officers who detect are like experts in detecting impairment. So they're very limited amounts in the state, because to get this sort of specialization, it's very difficult and it's very time consuming. And so there are limitations there too in just staffing and being able to provide a more expert opinion. And again, it is an opinion. It's an objective kind of thing. You know, it's not um, without any blood test or anything like that. A lot of this is up to the officer's judgment. And so that's another limitation, is, you know, having specific people who do this a day in and day out. I think they said there were like maybe 3 or 4 just with this, the state law enforcement department. So.
Yeah, I think it's the drug recognition expert training.
Yeah, that's
is
it.
what
Yeah.
they go for. And there was, I know there was like dedicated funding to increase DREs in the state when the legislation passed originally in 2021. So I know that they've been working on that, but you know, if only, I don't even know, if only 4% of the officers in the state have that training or something, you know, that's a pretty small number. And I have no idea what the figures are. So, but that is sort of a challenge.
Thank you. Any other questions or comments? That was really remarkable. Yeah. I don't see additional hands raised. And then I think next that we have hearing from Haley on cannabis use trends in New Mexico.
Yeah, let me share my screen real quick. So I actually gave a presentation last week to the Department of Transportation DWI work group, just on some general trend data. Just because I think it's helpful to be aware of sort of what we're seeing in use trends for them. So I'm reusing those slides today. Apologies that I wasn't able to really update them from them for you all, but I won't go too into detail into every slide because I know you all are very knowledgeable in cannabis, but I'll give you at least an overview of, I think, the parts that you all might be interested in. So hopefully you all are seeing my slides. So essentially, just in case anyone's curious, the current state policies on adult use, this is a map state to state of the states with legal medical cannabis and the states that have legal medical and recreational or adult use cannabis. So the dark green, which includes us, are the legal adult use states. And then some of those states in gray may have like very low THC concentration medical programs, like they'd almost be considered like a CBD type state. So that's something to consider, that this map doesn't really differentiate here. But currently we have 23 states with legal adult use, and Delaware and Minnesota, I believe, were the most recent states to legalize for adult use. And then I'm sure you all are aware of the timeline. So again, I won't go too much into detail, but I always think it's important when we think about some of this data that decriminalization passed in 2019. Then we had our Cannabis Regulation Act in 2021, but sales didn't begin until April 2022. So I think that's just always important to note, because data can have such a significant delay that some of the data I'll be showing you today is before sales actually began. So there's still more to see in the future, I think, for our state. But this slide might be of interest to you all. Just it's about the different cannabis DUI laws state to state. So the states in sort of that sage green color have a zero tolerance law. This is from the National Conference of State Legislatures, so they have sort of an overview there. But zero tolerance laws prohibit driving with any amount of THC or its metabolites in the body. Then per se laws are the states in blue. those prohibit driving with a detectable amount of THC in the body that exceeds the legal limit that they set in their statute. And from what I found, it seems it ranges usually from like 2 nanograms per milliliter in the blood to 5 nanograms per milliliter. So it depends on the state. And then like Washington, for example, who was, they were at the Cannabis Summit, they have a per se law. So that was something they talked about, where I think the metabolite thing came into play, because I think they specify in their law that they look more for the more active components when they're looking at the per se limits. And then the orange-ish color, which includes us, is just an under the influence DUI law. So it basically just requires that the officer determines that the driver is under the influence. And so it is interesting because, again, I think this is why sometimes the investigation may stop once alcohol is determined, because that's easier to prove. But it also means, in my opinion, that there could be concern of if there could be any personal biases introduced in how you determine someone's under the influence if you don't have alcohol in the system, where that's more easily provable. You know, who might be more likely to be assumed to be under the influence. So that's a concern I've heard brought up by community members that I think is a valid concern. And then Colorado is sort of maybe that dark orange color on the map. They, I guess, have what's called a permissible inference law. And I'm not a legal expert, but they say it basically means that if THC is identified in a driver's blood in quantities of 5 nanograms per milliliter or higher, that it's permissible to assume that the driver was under the influence. So I'm not sure why that's different from per se law. I'm not a lawyer, but they do list them separately there. All right, and then we'll go into health effects next. So you all know these health risks and therapeutic effects. We may have even gone through these maybe at the start of this group meeting, but essentially these tables are just an overview from the National Association of Science, Engineering, and Medicine summary, and then also the Colorado Summary of Evidence. Colorado has a lot of funding towards their public health work on cannabis. So every other year, they update their sort of very broad literature review on cannabis and health effects. They've got a lot of great reporting. So I often turn to Colorado when I have questions about you know, what more we could be looking at, and some of the current evidence too. So then the next table was just a table about the therapeutic effects that we know. So again, I'm not going to go over this with you all, since I think you all are pretty well versed. And then common methods of use. I know you all know this as well. So I'll just point out that the difference between ingestion and inhalation is huge for cannabis, especially when we're talking about driving. So I think it's really important that it's emphasized that edible products may have the onset of effects delayed, and that the effects may last longer. And I know that a lot of the educational materials that medical cannabis has worked on emphasizes that point of sort of like the start low, go slow thing, harm reduction messaging with edible products, but also that you need to be more aware that the effects could last longer. So I know I've seen that in the medical cannabis educational literature, which is great. All right, so to cannabis use and driving. So after alcohol, cannabis is the substance that's most often associated with impaired driving. But I would also point out that cannabis is a commonly used substance after alcohol. So that is part of the reason why you probably see it associated with impaired driving more often. But we do have studies showing that THC may impair a person's driving ability by slowing their reaction time and impairing their ability to quickly make decisions, which is of course important when you're driving. It can also impair a person's coordination and distort their perception. So there have been studies where they essentially have a person use cannabis and then run through a simulator. They've done different studies like that have shown that cannabis, specifically THC, can impair a person's driving ability. The co-use of alcohol and cannabis has been shown to increase impairment and crash risk. And then again, the onset and duration of effects of THC differ by that method of use. So typically in the current literature, it's recommended to delay driving at least 3 to 6 hours after inhaling cannabis. And then it's typically recommended to wait at least 8 hours after ingesting cannabis. But like we've already discussed, sorry, my slides take a little bit to change over, it seems. Maybe my internet's being slow. It's still not moving. Okay, there we go. So like we were discussing, measuring the true impact of cannabis use on road safety is very challenging. So like we discussed, the THC blood level and impairment are not closely related, unlike the blood alcohol concentration. DUI investigation may stop once alcohol involvement is determined. And then another big thing you'll see pointed out in a lot of reporting is that this increased focus that we now have, especially in states that have legalized, can be biasing the data, because now we have more officers trained to recognize it. We have more focus on making sure that we are, keeping that focus on that portion of road safety. And so you may have just more arrests or more involvement there on the sort of officer side of looking for it on the road than we had previously. And more emphasis on getting it reported too. So that can sort of bias some of these data after legalization takes effect, and especially in those states where there's been this increased focus. So then the National Highway Traffic Safety Association, I always forget what the last day is, they did a crash risk study in 2017 where they found that there was no significant crash risk increase among cannabis using drivers compared to drug-free drivers. So that was a study where they were in a city where any crash that they got a call about, they went on scene and did testing of any of the drivers involved. And so essentially they found that there was no increased risk among those drivers that had tested positive for cannabis versus those that hadn't. So that was sort of an interesting finding. They did note that there can be some confounding factors there too. Young male drivers are more likely to be involved in crashes, and young males are often more likely to use cannabis as well. So that's sort of an interesting note that they made there. And then when you look through the literature, studies have mixed results when they compare motor vehicle crash and fatalities in legal recreational use states compared to control states that do not have adult use or recreational use. So when we're looking at the population level, at this point, the research is really mixed on whether or not states that have recreational or adult use cannabis are seeing increased motor vehicle crash and fatalities, or if as a whole, all states are starting to see sort of an increase. So I link at the bottom there was a systematic review that I looked at, but there's a few different ones you can find. And at this point, the evidence is just really mixed at the population level. So really more research is needed here. And then we'll wrap up with just some trend data that you all might be interested in as well. So we have our Youth Risk and Resiliency Survey, which is a survey among New Mexico middle school and high school students. This is high school student data on their current use of cannabis. So it asks if they've used cannabis in the past 30 days. We've held pretty steady for many years at around 27% in New Mexico. 2021 did see a dip to about 20% of high schoolers reporting current use, but a lot of our substance use data in the 2021 survey dipped. And so I'm curious to see what'll happen when the survey is done again in the fall of 2023. We'll have that data probably late next year, if I had to guess. Because that 2021, of course, is we had the pandemic going on. And so perhaps there were differences in how students' lives were outside of school that may have contributed to some of the dip that we saw. So whether or not that holds, I think we need the 2023 data to figure that out. But we did add a question about cannabis use in driving to the YRS in 2019. So this graph here is showing you the 2021 data. So we had 13% of New Mexico high school students reporting that they had used cannabis and drove. And that's compared to 4.6% of high school students reporting that they had used alcohol and drove. So to me, if nothing else, this indicates that there's maybe a lower perception of risk there, and sort of a need for more public education about the risks. And when we looked at the 2019 data, so the first year we had this question, the difference here was higher. So 19.6% of high school students in 2019 reported that they had used cannabis and drove, compared to 6.4% in 2019 that reported using alcohol and driving. So that difference was a lot bigger in our 2019 data. And then switching over to our adult use data, and again, this is before sales started, but this is our behavioral risk factor surveillance system. We added questions about cannabis first in 2020. This is our 2021 data. I'm hoping we'll have 2022 data maybe by end of summer. But 15.4% of New Mexico adults reported current cannabis use in 2021. And that was almost exactly the same as our 2020 data. It was 15.3% in 2020. But you can see that there are differences in gender and age groups here. So by gender, males are more likely to report current cannabis use than females. And then by age group, we see that those younger age groups are more likely to report current cannabis use compared to the older age groups. And then another thing that I just thought was interesting to note is the frequency of use that we have reported among New Mexico adults who are currently using cannabis. Again, this is before sales, but 61% report that they use daily or near daily, so 20 to 30 days out of 30 days. We do have some differentiation in the 2021 and 2020 survey, where we did ask if they use for medical use, recreational use, or both. I don't have it included here, but I always like to point out that some folks, of course, may be using daily or near daily because they're using it for their medical conditions. So I think that's important to note. And then I wrapped up, when I presented last week, I just wrapped up with a reference to some of the great medical cannabis program educational materials. I guess I'll also mention, we talked about the RLD campaign that's happening. I haven't heard if they include driving things or not. I don't know if anybody knows about that. But Department of Transportation has also deployed sort of some ad campaigns about the risks of driving after using cannabis. So there are a few agencies now with different educational materials around this issue. All right, and that's all I have. So any questions?
Thanks, Haley.
Yes, Eileen.
Oh, all I was going to do was actually put a clap emoji in the chat because I thought that was tremendous.
Sorry, I saw a raised hand.
I hadn't intended to. My apologies. Somehow I raised my hand. I'm not seeing any raised hands, but knowing that other people also are thinking they're clapping or they're sending their claps without showing their claps. Okay, everybody. Thank you. That was fantastic. That was so helpful. It sounds as though I didn't see that hands were raised. I didn't see that people were adding questions to the chat. I think that you provided really tremendous information and a lot of thoughts moving forward. About like you talked about the risk perception with young people, and then also the delay for data, right? So, maybe I will stop there. And I see Gary's hand is raised.
Yeah, I was just a little bit intrigued about the drug recognition training. Do we have a team here that's doing that instruction for our drug officers here in New Mexico? Was it imported from Washington? Is it a national training, or is it pretty much being developed siloed in states? Did they say?
I don't know what the training is based on, but I know that there's an academy in state that's specific. It sounded like it was maybe a 3 to 4 week long training that officers can take. It's in state though. I know I've looked at the website before, but it's been a long time, so I could probably hunt that website down again and share it with you all if that would be of interest.
And you mentioned that you were intrigued whether the officers, because they received this training, were then skewing data in a certain way. Do they ask, I mean, has anybody looked, do they ask different questions, and is their report, when they do report, more inclusive of cannabis and other drugs when they do make one, or did they discuss that?
Yeah, I think that's just like a limitation of all the data. Like if you have more people out there trained to recognize it, then you might just be biasing the data because you have that additional training for the recognition. So I think that's been interesting. And then one thing that I found, and I honestly can't remember if I found it after the summit or if it was something that was brought up at the summit, but they'll do, I can't remember what they call them, but they've had trainings in the past in states where they'll have people basically drink and do simulations, and the officers like can see how a person might behave if they were drunk, sort of. But it sounded like Washington had hosted one where they did that, but with cannabis. And they kind of had to, I don't know, they kind of had to figure out a weird way to get that done. But that was one of the things that they felt in Washington was lacking, is that they didn't really have that actual experience of seeing someone in person using the substance. And so they, I don't know, I guess they figured out a way to, I'd have to remember what it's called, but they figured out a way to do that type of training in Washington that officers found really helpful up there, I guess.
And if they have this training, do they do any additional paperwork when they submit a report? I'm just sort of thinking like where, if we ever did want more information, which officers would be the best ones trained to provide it to us? And if they're already required to do extra paperwork, I don't know. That's just where I'm going with this, so.
Yeah, and I'm not sure, because I don't think, like when it comes to arrest data, I don't know that there's any consistent database across the state. At least that's not something I'm aware of. And so I think the crash report data, I think that's uniform, it seems. But a crash is different from just pulling someone over that you suspect might be under the influence. Part of me also wonders, though, because I know that was a frustration that got brought up of how it's more difficult to pursue, figuring out if someone was under the influence of another substance besides alcohol. That was sort of a frustration that was reported among officers. And so I wonder, though, if maybe the training could also emphasize that regardless, just getting the person off the road in that moment, if you truly do think they're impaired, is more important than maybe getting the conviction in the end, I don't know. That was just one of the thoughts I had when we were at the summit too, is like, I can understand why that might be frustrating, that you then do all this work and maybe nothing happens with it, I guess. But if you still got that person off the road in the moment, if you truly thought they were impaired, isn't that what's actually important? I don't know. That was one of the thoughts I had.
I think my friend used to run the one in Farmington, and that was related to alcohol. And true story, several of my friends were the people who had different amounts of alcohol, and that the officers were like, yeah, they were the people who volunteered for that. I think that could be a really interesting thing to consider, because my impression was that what they do is they work on both things at once, and once is to get them off the road, but then the other is the other part of the conviction. I think that could be something to consider, inviting someone to come to speak about, especially one of the people who had received the training that has to do with cannabis as well too. Something we're coming up with a lot of people to invite, but I think it would be really important. So thanks. What other comments and questions do people have? I'm not seeing hands raised. I'm not seeing additional notes in the chat. And beyond what we saw that Dominic had just added about the Cannabis Control Division campaign ads that are on the RLD website. And then up above, of course, is also what Libby had added and Dominic had added as well. And then I think that thank you to Gary for having already provided us the update in the current labeling regulations. And then maybe I'll pause to see what are some other items Maybe, but actually, before I go to the other items from the committee members, last time we were here, we had talked about looking to map out what our report would look like, and that we ended up, due to some scheduling challenges, not being able to have that conversation just yet, but we'll circle back to that. I just wanted to provide that update. Yeah, thanks. And then to see what are some other items from the committee members, including if you wish to be someone who wanted to present a journal club article, because we had Eleni did a great job on that last time. And we have, I think that, Crystal, I think we probably added you to the Zotero, that is the compilation of different journal articles on that crosswalk to what are the dimensions that we're to report to back to the state legislature. And if we haven't added you, then we will. And I will have to get help with that because I don't know how to do that. So Libby's a superpower, I think, person with that. But anybody who wishes to to volunteer, and it could be the article if you're choosing from that compendium or not. And it's okay. I'm just going to pause a few seconds to give people a chance. Okay. I didn't see any raise your hands, and that's okay. There's a lot going on. I'll do one. And if anybody else wishes to as well, then we'd love to hear from you offline.
I can, the next meeting, sorry, Eileen, I can present one.
Oh, thank you. Thank you, Crystal. Thanks. Okay. And then, so maybe then now we'll move to scheduling and thinking that I know that multiple members weren't able to join us today due to some things that appeared to be, I didn't hear that they were standing commitments that left the people who weren't able to join us today, those who had RSVP, that they were unable to do so. So I'll ask in general, how does the third Tuesday at 10 o'clock, looks like that would be the 15th of August. How does that look for people? And I'll ask if that the 15th of August at 10 o'clock, if you would either raise your hand. Yeah, thank you, Alan, modeling it for us. The thumbs up, if that works for you. Okay, I see a number of thumbs up, but I don't see everybody. So it looks like that does not work for Crystal. It doesn't work, I didn't see for Gary. And oh, you're coming back from Greece. Okay. We wish you safe travels. Okay, and Haley will be out of town. That's okay. Thank you. That's gracious. Gary, I think that I didn't see that had worked for you. So we should find it.
I actually think it is going to conflict for me, but we do have ample support staff to hold the meeting, you know, and so don't let that be a reason not to hold it on that day.
Okay.
We want to try the next week since Crystal wanted to present.
Yeah, what about the 22nd? So I'll ask if people, if the 22nd at 10 o'clock, if you would give either an A-OK sign or a thumbs up if that will work for you. Okay. Gary, is that, yeah? Okay. Dominic looked like yes. Haley, you're still out of town? That's a great trip. Good for you.
Actually, I will not be available on that week, but you can, again, as Gary was saying, if that's better for the committee members, that is perfect. We're always going to have some people who are going to be missing. So, you know, don't let that be a barrier for the meeting.
Okay, thank you. And also Katie, thank you for your thumbs up as well too. So it sounds like that we can move forward with that on the 22nd at 10 o'clock, that Crystal will present an article and I'll present an article, and that also Libby would love your help making sure that Crystal has access to Zotero. And I think that we go from there. And thank you everybody for your great work. Thank you to all the people who presented, to all the people who were present, who are part of this learning culture. I hope that you are all well, and that between now and then that you have lovely, lovely summers with lots of dogs, lots of cats, and lots of pasta or dark chocolate or milk chocolate, whatever works for you.
And bees.
And bees, yes, I was trying to remember the bees. Thank you. Lots of bees. Okay, take good care. Stay safe. Bye.
Thank you, everybody.
Thank you.
Thank you.